Understanding the needs of patients and families has been crucial for hospitals as they respond to the COVID-19 pandemic in their communities. AHA's Joining Hands for Greater Impact series is highlighting how hospitals have been partnering with community stakeholders to ensure ongoing care for their patients, healthcare workers, and communities. Through this effort, we are sharing stories from across the country of how these partnerships have addressed urgent community needs throughout the pandemic. This podcast explores how hospitals can partner with their patient family advisory councils to guide their COVID-19 vaccination strategies. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. This podcast was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. It is moderated by AHA's Julia Resnick, Senior Program Manager for Strategic Initiatives. She's joined by Libby Hoy, founder and CEO of Patient Family Centered Care Partners, and Connie Montgomery, a member of the Medical University of South Carolina's Patient Family Advisory Council. Libby and Connie will discuss their experiences engaging with and advocating for patients and families throughout the pandemic.
Libby and Connie, I'm so glad to be talking with you both today. Thank you so much for joining me. So, Libby, let's start with you. We're going to be using the acronym PFAC a lot in our conversation. So, for those who are not familiar with PFACs, can you describe what a PFAC is and its purpose?
Sure. So PFAC stands for Patient Family Advisory Council. And sometimes they're referred to as patient family partner councils. Sometimes they're referred to as subject matter experts, lots of other terms out there. Basically, what it is people using their lived experience navigating the healthcare system to partner with hospitals, research teams, measure developers, quality improvement organizations, all kinds of healthcare stakeholders to improve and co design. It's really bringing the perspective of the patient and the family caregiver into our processes to design, evaluate, and improve our systems, our health systems.
And you have an organization that's focused on PFACs. Can you tell us a bit about it?
I do. So, Patient Family Center Care Partners, or PFCC Partners, was started in 2010 as a result of my family's experience navigating the healthcare system with three sons living with mitochondrial dysfunction and then my own cancer journey. And it's really that perspective. I have served in the role of patient family advisor since the mid 90s when we were excited to comment about the color of paint choice and have seen the evolution of that role into working directly to improve patient safety and patient outcomes.
That's wonderful. And Connie, so we have you here because you're on a PFAC at the Medical University of South Carolina. So can you tell us a bit about your hospital and your community and your experience on the PFAC?
Absolutely. I want to thank you guys both, Libby Hoy from Patient Family Centered Partners, and yourself, Julia Resnick, for having me here today. I'm a patient and family advisor with the PFAC at MUSC Health in Charleston, South Carolina. Charleston is pretty much the low country area of South Carolina, and MUSC Health has a 700 plus bed hospital that's a teaching hospital there. This hospital is the main comprehensive educational health center for our state. This hospital has many components to it because we have a children's hospital. It's called Sean Jenkins. We have Pearl Torville Women's Center. That's also a part of it. We have our main hospital, as well as we have the Institute of Psychiatry. So the hospital is pretty comprehensive in the services that it provides, but it provides services to a community that also has a rural outlying area. And we have satellite hospitals there in those smaller units to meet the needs of South Carolinians. And so those areas are Lancaster, Marion, Chester, and a small town called Lake City, South Carolina. But the hospital overall, MUSC Health enterprise wide, has about 17,000 employees. But the main hospital only has about 700 plus beds. It's a wonderful place for people to learn and train and meet others, as well as experience patient-centered care, due, due in part to the wonderful patient-centered care manager we have there. Caroline DeLongchamps is her name at the Medical University of South Carolina. The PFACs, because unlike a lot of hospital systems, we have 5 PFACs. We have our Youth Advisory PFAC, we have our Institute of Psychiatry PFAC, we have our Adult Ambulatory PFAC, for which I am a member, and we have additional PFACs. So we're very thankful for that. And I'm delighted to be here with you guys today to talk a little bit about some of the work we've done.
That's a really great background from both of you. So, the past year and a half has been really challenging with COVID, and I'm sure that's put a twist on your PFAC activities. So, can you both talk a bit about what the role of PFACs has been during COVID-19 and what situations you've seen them be particularly useful in? Libby, let's start with you.
Sure. So, the core work of patient and family centered care partners is to develop the infrastructure for highly valuable and highly sustainable patient family advisory councils. And so, through that work, we've supported the establishment of over 200 patient family advisory councils. And so, it was kind of an interesting time to see what happened to all of those. Some of those were well established, sort of years in the existence, and then others, like our work with LA County Department of Health Services, those were fresh new patient family advisory councils that had barely had the chance to get their legs under them before the pandemic hit. And so I think it's been, as we've looked at our community of partners all across the country over the course of the pandemic, the patient family advisory councils really sort of divided. There wasn't a lot in the middle, and there were a number of organizations, like you'll hear about from Connie, that really leaned into their patient family advisory councils to partner and help them navigate this pandemic, whether that was communication. So we did some focus groups with patient family advisory councils in Los Angeles County to find out at the early stages, what are you most worried about, and what information does the health department need to put out to help people to feel that sense of security. I think there were those that leaned into their PFACs, and then there were those that really leaned out of them. If you remember the initial phases of the pandemic, when all of the command centers were getting implemented, that's a really, for lack of a better word, militant response to a pandemic, which is what was needed at that time. What I saw was, wow, we've really integrated PFACs across hospitals and in their operations, but never occurred to me to have them implemented through their emergency response teams. And you can't do that at the time of a pandemic. And so that sort of started us off on this trajectory of kind of dividing. And so that was sort of the initial phase. I think that a lot of organizations are leaning back in and trying to sort of reboot, navigate those waters. So yeah, I kind of just saw this divide. Some leaned in, some leaned out. There wasn't a lot going on in the middle.
Connie, what was your experience?
I have to say, COVID changed everything. It taught us what was possible at MUSC Health. And the reason why I say that is because it was during the pandemic that our PFAs on our PFACs accrued the most volunteer hours ever, 1,770 to be exact, in 2020.
Wow.
And the reason is because that is a wow. It's thinking outside of the box and utilizing what was available to us at the time. Technology was available, right? So everybody went to virtual, right? So we did a lot of meetings virtually through Zoom, WebEx, and Microsoft Teams. We utilized those platforms to continue having our monthly meetings, and some of our PFACs, like our children's PFAC, they accrued weekly hours. They moved their PFAC from monthly meetings to weekly meetings because people saw a need and gained so much insight from community members sharing at those meetings exactly what was going on. And I think for MUSC Health, being able to utilize the fact that we had members that could act as liaisons for what was happening in the overall community and bring that to the hospital, and us partnering and fostering relationships, it really helped in them preparing specifically things they needed to do to help with the pandemic. For example, I'll just give you one for example. our PFAC members and PFAs like myself and Kelly Lloyd, we got the opportunity to participate in the COVID vaccine distribution task force. Had not having a PFAC, that would not be possible for us as PFAs, but it lended us that opportunity, then that lens and that vantage point for us to see all that it took place so far as the logistics in setting up mass vaccination sites, and then us providing an input that we thought was helpful, just using proper terminology on tip sheets that made things easier for people to understand, like patients and families like ourselves. So it was these type things that just, we changed what was possible.
That's amazing. And I think, I mean, there's so much in there about like how much we desired human connection during those early phases and like getting comfort and confidence by having this group of people to discuss with and having that connection to the hospital. That's so many threads there to pick up on. But Libby, back to like that national perspective, I know you've really had your ear to the ground to understand patients' voices during the pandemic. So can you share a bit how you've seen attitudes towards COVID-19 and the vaccine change and evolve over the past year?
Yeah, it's been fascinating and such a privilege and an honor, really, to be supportive of the PFA network. So, PFCC Partners has a network of over 800 patient and family advisors. We got a lot of new advisors into the network during 2020. I think people that were comfortable in that role were now looking for places to be effective. And so, through the PFA network, what we saw right off the bat was a lot of concern about, obviously, about COVID and the pandemic. And patient family advisors are, as I said, people with lived experience. So often people experiencing chronic illnesses. And so for that population, felt a little bit more even vulnerable to the pandemic than the general population. And so we sought early on to create connections and make sure that none of our community members felt isolated or alone during that period. And so we set up Friday morning coffee chats. It was just a time for people to jump on a Zoom meeting with a cup of coffee, and we had no agenda. We just opened it up for people to express their joys and their fears and their concerns. So over the course of, the last 18 months, it's just been, like I said, an honor to walk this pandemic with such a diverse group, right? Connie's been on them several times. Such an incredibly diverse group. We've got Pastor Bruce in the farmlands of Iowa, and we've got Connie and Deneen from the South, and people from Chicago and Boston. And so it's been a fascinating conversation to see how different communities have reacted to first the pandemic and then to the vaccine rollout. And that is one thing I have learned is if you've talked to one community, you've talked to one community. We say that about hospitals, right? If you've been in one hospital, you've been in one hospital. Communities did things very differently. And I think that was both, in hindsight, a blessing and trouble point, right? Because there was a lack of predictability that people felt and wore. I think it created a bit of confusion. Like, well, wait, why is your community doing that when our community is not masking? Or, so there was a good example. We had different masking orders in this coffee chat. Nobody in my community is wearing a mask. And in your community, nobody will go anywhere without a mask. And so how did you get there? And did your local governments do that? Did your state governments do that? And so really big differences, and having that in the same conversation week to week was really fascinating. I also have to just pause and say we saw a tremendous amount of suffering and loss in this coffee chat. And that was really difficult. That has worn on a lot of us all year. People really struggled this year, and no one was spared suffering this year. So that part of it, I have to acknowledge and recognize that has been tough. And yet I am so proud of this network and this community to show up for each other every week and show up for each other in so many different ways. So I just have to share that. So let's move forward into vaccination, where in the fall of 2020, we were eagerly anticipating. And we had some great conversations. We had people that said, no way, I'm not doing it. I'm not going to. It's just too fast. I just didn't understand, how we could get there. And then we had others on the call that were like, I first in line, whatever I have to do, and struggling, quite frankly, with moral questions about how far would they go to get into line first. And so it was quite a divergence. There was a number of people who said, absolutely not. And then when it became available to them, they went right in and got it. So I think there were some struggles with your fear of actually contracting COVID and your sense making that made you hesitant in the first place. So that was really interesting to see. And we had some conversations about, what made you flip? What was that transition point? And I would say that my recollection of, I remember three people in particular I asked that question to, it was a gut response. It was, really a gut kind of influence. In terms of the vaccines, and all of the social injustice that we also experienced in 2020, there were very legitimate fears in our communities of color in terms of trusting the vaccine, and especially how quickly it was put to market. So I think that evolution of thought and just kind of waiting to see what happens with people who are getting vaccinated and recognizing that very few are experiencing negative side effects. So I think that progression has come along as well. Access was a huge conversation, is still a huge conversation, but it's changed. I just was on a listening session the other day and hearing the difference in access problems. So in January, February, the registration systems were all online. That immediately cut off a number of our most vulnerable populations. They were complicated, they were inconsistent, they were different county by county, which really caused great difficulty and confusion. And so I think as those systems have matured and gotten better, that access has also gotten better. So there's different access issues now. And some of that is around social pressures. And, what do your parents think? What do your grandparents think? What does your community think? And those social pressures are influencing people's decisions and access to getting the vaccine. So we've seen this hesitancy change and shape differently over the course of the last 6 months or so.
That is fascinating. So, Connie, in your context, what have you been seeing in the evolution of vaccine confidence and acceptance and access?
I'd probably have to start at the beginning of the pandemic, in the early 2020, when we saw so much uncertainty. And then there was so much uncertainty put out there and so many changes placed out there in the metrics or a measuring system used to keep or try to prevent and keep the virus COVID-19 at bay. There were so many changes that occurred so fast, and they kept happening at different speeds in different places. And depending on your geographic location, you was hearing one thing, and then living in another area, you may be hearing something else. And it got to the point where so many communities was confused, and community members was confused about actually what they should do to prevent getting COVID-19. But then things started to formulate and come together a little better with, of course, the vaccine distribution task force in the various states, because each state had its own. And with MUSC Health, I was a part of MUSC's Health State Vaccine Distribution Task Force. And we saw early on that we needed to put out information that community members could read, have in their hand, and was evidence-based information that could be understood at the most basic of level so that people knew what it was they, were essentially facing if they decided to get the vaccine. So we put out something called tip sheets, and I can't say how invaluable I feel like the support and the help of the PFAs, the patient family advisors, were on helping design that messaging. The information was greatly appreciated from that vantage point, and to allow our PFAs to have a voice in that process was a great experience. But also, in the marginalized communities, I think the pandemic showed a spotlight on the difficulties that Black and Brown people and people from lower socioeconomic statuses, what a struggle life was already for them. I'm talking about prior to pandemic, and then the pandemic just comes along and highlights it in a way that nobody could deny it. So we were dealing with the pandemic, but then here we were dealing with problem solving for all these new problems that existed, but that were now highlighted. So there was a lot that had to take place. And I think with MUSC Health, I think we did an okay job with adding Black and Brown people's stories and lower socioeconomic people's stories to like our patient story library so that healthcare practitioners could listen and hear from the vantage point or the perspective of people from marginalized communities or underrepresented communities. I think that was very important. I also think it was very important that we developed, and I was the co-chair of our diversity and equity and inclusion task force. I think that was important because having these things in place allowed a vantage point for care team members to actually hear from the community members that was living, like Libby said earlier, had the lived experience of living life, in the middle of a pandemic with already great healthcare disparities, right? So that was wonderful to have there. But then I look at how the pandemic helped us problem solve. And what I mean by that is telehealth. Telehealth came into existence, but what that did was it helped with the accessibility for those people who could not get there. But then we also had to add in another component by having just audio calls and phone lines because not everybody had Wi-Fi capability. So all of these things had to be taken into account. But the pandemic made us better because it helped us think outside of the box and create these new ways to help community members. And it encouraged folk to listen to the voices of their patient and family advisors. You really don't know the importance of patient and family advisors and others until you hear their input and their side of the story, their lived experiences. So the pandemic, yes, we had some great trouble points, but it also caused us to troubleshoot and problem solve.
And Julia, can I build on Connie's comments? Because I think they're so important, and she's highlighting a real fundamental shift in what we're seeing in patient family advisory programs or councils. One of the things that I've heard and listening all over the country is vaccine confidence is not so much about information as it is about trust. So that information has to come through trusted sources. I can't walk into community, underrepresented community, and expect that the information, as good and solid as it is going to be trusted. And that's a reality that we have had the opportunity, Connie, to come to in 2020, right? We've recognized that. And so I think that's really important. One of the ways that we're thinking about patient family advisory programs, so I'm using the word program instead of council differently now, is because of the work that we've had the opportunity to do with our own DEI work group and wonderful partners like Connie, who inform us and have worked side by side with us to struggle through some really difficult questions like, when I look at that group of 800 patient family advisors, what is the racial breakdown? And that's not representative of our communities. And so what Connie's talking about is really reaching out beyond the PFAC even. And so what we're doing at PFCC Partners is developing a new model for patient-family partnership, which we're calling the hubs. And the hubs are going to provide more opportunities in more inclusive types of activities beyond not doing away with, but building on the strengths of PFACs to really get into communities and moving trusted leaders into communities to create those connections. So I think that's a really important, what we realized, particularly in last May after the killing of George Floyd, was inclusion was always one of our core values. Diversity and inclusion, core values. How were we expressing those? And so we really had to take a hard look inside first and recognize, gosh, we're inclusive of everybody who comes to our doors, but we don't have enough doors and they're not in the right places to consider ourselves inclusive. And so the hub is really giving us an opportunity to place more doors into different areas where people have been underrepresented, provide them the kind of support they need to have a voice and really contribute. So I think what Connie highlighted is so critically important, and I'm loving the shift we're seeing across the country in not just our work, but other really innovative groups who are authentically making that effort.
And I'd like to just add another comment to what Libby just said regarding beyond the PFAC. And I love that because when we think about our patient and family advisory councils, let's not just see ourselves boxed in either that virtual world in those literal boxes or in that room, literally in that PFAC area. Let's see ourselves beyond that point. Like in MUSC Health, I can tell you, I love the fact that they use our PFAs in safety rounds. They use our PFAs in facility design and renovation. They use our PFAs and their input in policy reviews and visitation policy updates. I sit on the arts committee. I mean, okay, what does the art committee have to do with PFACs? Well, it has a lot to do with PFACs because first touches are important. When you enter into a hospital, the art that you see on the wall, the way people greet you once you enter the door, honey, all that's important. And that South is coming out of me. You can hear that Southern touch. But absolutely. So, the PFAC, yes, that's a room and literally in virtual boxes when we're on the Zoom. But honestly, we go well beyond our touch, go well beyond the PFAC room. And I'm loving that MUSC Health gives us an opportunity to sit into and be a part of so many other committees. Patient Education Committee, Steering Committee. I was on a Patient Education Steering Committee meeting this morning, helping to provide input. The root cause analysis team, we have a member that's a part of that, where if there has been a problem that's presented itself there in the hospital, they get down to the root cause of it. Why did it happen? How can we prevent it in the future? And what do we need to put in place? And our PFAs, our patient family advisors, are on those councils. So yes, don't get me started with beyond the PFAC, because as you guys can tell, I get excited about that. Also, they're utilizing the skill sets of the people on the PFACs. I mean, I'm a talker. That's what I do. I'm an orator. I'm a keynote speaker. That's what I do. I love to do that. And a program developer. So I came up with this program, Here with Your Eyes, See with Your Heart, Compassionate Healthcare. They've allowed me to train their staff and they get D&I credit because every hospital staff person needs at least 4 hours of D&I credit, diversity and inclusion credit. And I just think that's absolutely wonderful, utilizing the talents and the gifts that are placed in their PFAs that are on those PFACs.
I love everything that both of you have been saying. Like, it has been such a hard year for so many people, but like these silver linings that we're able to pull out and how like it just helped crystallize our values and
Yeah.
act on them and what we think is important. And Connie, I love how you're bringing up all these different uses for patient family advisors and the different ways that hospitals can leverage their insights and skills. So as we think back to like vaccine confidence, and we're deep in this vaccination stage of the pandemic where there's a light at the end of the tunnel, but there are still a lot of people who aren't vaccinated yet. How do you think hospitals can partner with their PFACs to build more vaccine confidence in the communities they serve?
I think they definitely have to utilize what is there. And what I mean by that, they're community based organizations. They're going to have to go out and talk with the community based organization leaders and go to where patients are and meet people where they are. May have to get creative and think outside the box. You may have to have mobile vaccine clinics that go to the sites where your rural outlying folk are. Then your messaging, it needs to be carried by people that look like the people you're going to serve. I mean, this is just imperative. I trust people that look and sound like me, right? As we all do. So that's just a part of it. We're just going to have to make certain that we continue vigilantly sharing the message of the importance of the vaccine distribution and getting the vaccine out to all populations so that all people have that opportunity to have a healthier tomorrow.
Before we go to Libby, can I just follow up about what messages that you've seen resonate most in those communities?
Care for oneself is important, but caring for your brother by getting the vaccine is showing that care for others. And that seems to resonate wide and far.
Yeah.
I would agree with that. Connie brought up so many important pieces, and that is, if you put that all together, every one of us has a role in this, every one of us. So my role might not be to deliver that message, but my role might be to create a place where we raise the capacity of natural community leaders. So yes, CBOs, yes, community-based organizations, they're essential to the health quilt in our communities. They're an essential piece of that, and they need to be brought in. But also, there's natural leaders in communities. Maybe it's a favorite teacher, high school teacher, or maybe it's a favorite nurse in the community, or maybe a preacher or a faith-based leader. There are natural leaders everywhere. Maybe it's just the mechanic who is always there for you. And so, what can we do as an organization to build the capacity of those natural community leaders to carry the messages forward in a way that resonates with that local community? Because even for us to sit on a national call and say, what messages resonate, that overall message that Connie said, I would agree that resonates. Many people that I speak with want to do what's best for themselves, for their families, for their communities. So I think leveraging that natural inclination and bolstering that is really helpful. But how does that get delivered in Connie's community, or how does it get delivered here in South Central LA, or how does it get delivered in Iowa, are really different messages. So I think, we all have a role to play in this to continue to improve vaccine hesitancy.
It's really such a beautiful concept to start to wrap up with, that, we are all part of the fabric of this society, and we're all reliant on each other for each other's health and well-being, and anything we can do to support each other and to keep each other healthy is really our path forward as individuals and as a society.
I would go so far as to say that's another silver lining that came out. The American people are so fiercely independent, and that's really a wonderful thing. It's a strength. But we're also fiercely interdependent, and I think that can be a strength too. We just need to bring that forward a little more.
And I think the pandemic highlighted that bond, because I see the United States. I'm from the low country. I'm a low country gal from South Carolina. I see the United States as a large patchwork quilt, and the common thread that binds us all is our humanity.
Yep.
Absolutely. So, as we look towards the future, for both of you, what's next for your work with your PFACs?
I think for MUSC Health, it's going to be being able to embrace this new hybrid world of, yes, starting the venture of beginning in-person meetings again, while allowing that opportunity for those virtual participants, because there are still some people that will be limited. Like, we have an individual on one of our PFACs. She's blind totally. She's not legally blind like myself, without these glasses. She's totally blind, but she can participate auditorily now because we're virtual. You know what I mean? And with the phone calls. So going forward, to keep some sort of hybrid model in place so that we can continue to have the voices of all the patients we serve.
Libby, any final thoughts on what's next?
Yeah, I think what's next for PFCC partners is to first and foremost conscientiously, intentionally, and sustainably create more diversity through inclusive activities to build equity in healthcare. What that looks like for us is changing our models a little bit, expanding the PFAC into more open-ended opportunities for every person to participate. I think that's a big focus for us. So I think that, and then telling the story. I think we have a lot of room to grow as an organization in telling the story of people in communities that are participating in these opportunities. We're so privileged to be able to hear these relationships, these partnerships like Connie has at MUSC, and other places that are less resourced, more resourced, rural, urban. We have such a great opportunity to hear about these. So bringing those highlights forward into the national conversation a little bit more, so that we can, as a health system, really leverage patient-family engagement as an active strategy to improve outcomes for everyone.
And it was my privilege to hear both of your voices today. So, Libby and Connie, thank you so much for joining me and talking about this really important work about how we can elevate the voices of patients and families now and in the future. And my key takeaway, and a phrase I'm going to be using a lot now, is thinking about how we can be fiercely interdependent with one another. And I really look forward to hearing how your work continues to grow as we move forward and out of this pandemic. So, for our listeners, we have a growing repository of resources on the COVID-19 vaccine distribution. So please visit www.aha.org/vaccine confidence to access this podcast and many more resources that we have with it. That's it for today. And thank you again to Connie and Libby, and thank you to everyone for listening.